Hi, welcome back to my channel. For those of you who don't know, my name is Tadeja. I have been a nurse for 3 years now. I am a psych nurse. I work with mentally ill patients from bipolar, depression, anything, you name it. I work with them. So I wanted to do this video about the NCLEX. I made a video a couple years ago when I had took the NCLEX um, back in 2021. So I graduated in 2020. I took my NCLEX the first time. I took it in 2021 of February, and I failed. I think I got up to like 100, maybe 50 or 60 questions, and I failed. I just had a horrible feeling. First of all, it was all the way in Jersey. It was pretty far from me. I didn't have anything to eat. I was like in a rush. I was really nervous. It was just not a good feeling. And plus, I had that gut feeling that I did not study enough. So that in itself was like, oh gosh, it was just horrible. So then I decided to do the trick where you try to register again and it doesn't let you register. And I realized that I failed. I was like hysterical, but I knew I was like, okay, this is my fault. I didn't have a plan and I did not study like I was supposed to. Some people, they're able to take it in 2 weeks and just pass. I would say at least give yourself a month. So I am here to tell you guys exactly what you need to do to pass the NCLEX. I'm going to be honest. One of the resources that I wanted to tell you about, they discontinued it, which I cannot even believe because that resource was so good. It's NCSBN. They had like a classroom setting and they had like 8 weeks, 12 weeks. Like they had different weeks and it went through a lot of subjects and it was a lot of, questions in between. So this was actually offered by the actual website, the actual people who make the NCLEX, and they took it down because I was looking for you guys. I was looking so that you can use that resource because that was a really good resource. So if anyone does have time, you probably want to write NCBSN and tell them to bring back the classroom setting because that was amazing. It really helped me, especially to go over the subjects that I did not know. But to tell you, the number one resource I used when I first took the NCLEX, I used UWorld, and it was just too, it was kind of too difficult for me. It wasn't given. It wasn't helping me. And I was just like, no, UWorld, people rave about it, but it wasn't for me. So what I used was Archer. I think it's a little bit more popular now, but when I took the NCLEX, it wasn't as popular. When I tell you, Archer prepared me so well. There was a couple grammar issues with it, but it was like straight to the point, easy to understand. And I was like, wow. So I actually set a plan. I was like, okay, I'm going to take 100 to 150 questions a day. So that's exactly what I did. Every day, because I worked a 9 to 5 at this time, I would come home, do my questions every day faithfully, 100, 150. It was more closer to 150 each day. So by the time I took the NCLEX, I took over like 5,000 questions by that time between that and the NCBSN. So I'm going to tell you right now, you need to practice questions. You absolutely have to. Aim for 100 to 150 a day. You need to be taking those questions and understanding the ones that you got wrong. If you already know the subject, move on. Don't review the subject if you already know it and you understand. If you understand why you got that question wrong, move on. Do not go back and study that. There's no need to. Just understand the question and move on. It'll save you so much time. So you want to go through those questions, and the ones that you don't understand or you don't understand why you got wrong, you want to go back and read up a little on it to make sure you understand. And then you continue to take those questions. But do that for at least 30 days. If you're going to do it, I would say at least 30 days. Once you do that, You want to take the mini test that they have. They kind of construct it like a mini NCLEX, and it tells you whether you have a high chance of passing or a low chance of passing. So you want to do at least two of those before you take the NCLEX. And if you get two passes, it's a go. That's what I did. Once I got two passes, I was like, okay, I'm ready. And you will feel like you'll be a little nervous, like, oh my gosh, but you'll know, like, after you took enough questions, you'll be like, okay, I took enough questions. I feel that I'm ready. Book that exam. Book that exam. And I will honestly say, book that exam no more than 3 months out from the time you got all your stuff. 3 months out. Give yourself 3 months. Don't take any longer, because then you start to forget the material and then you gotta study more. No, your main focus is you wanna focus on taking the questions. So create a plan, take 100 to 150 questions a day, go over the ones that you don't understand, and just keep practicing every day. 100 and 150 is not that bad, I promise you. Like, it'll fly by. And don't take them all in one sitting. When you take that 100 to 150, break it up. Do 50 in one sitting, take a break, do another 50, take a break, do another 50. You're done. Before you know it, you're done. You could do 50 questions like that. So do them at least no more than 50. If you want to do lower 25, that's up to you. But no more than 50 at a time. Take a break, because you want to take breaks. You don't want to, like, overwhelm yourself. So do that and you'll be good. I did use Mark Klimic as well. That was really good for little, mnemonics and short things that you want to remember. But don't confuse yourself with too many resources. Don't use no more than 3 resources. I highly recommend that, because all you will confuse yourself with all this different information and it would just be too overwhelming. But if you use Archer, I promise you, that is like, they have a high passing rate. They're good. So when I took it the second time, which was April 9th, I passed in 75 questions. Swear to you, 75 questions. But you know what I did differently? I made sure I had breakfast. I picked a closer spot in my same town to take the NCLEX. I took a break. Once we were able to take a break, I took that break. I walked around the building a little bit, took in some fresh air, went to the bathroom, did whatever I had to do, then I came back. So you regroup and come back to make sure you're going. Don't try to rush the process. Take your time. You're going to want to take that break. Don't rush through, because then you'll be anxious. You're already going to be a little nervous and anxious. So take a break, take a moment to breathe, whether you pray, meditate, whatever you have to do for those few minutes. Take a bathroom break so that you can regroup and refocus. I'm telling you, if you do those things, you will be golden. Like, you will definitely pass. And I highly recommend Archer. Archer has a crash course. They have crash courses. They have a couple free lessons on YouTube as well that you can check out. They do have like a crash course, which is, some of the ones I took. They have live ones and they have the recorded live ones, but they have a whole bunch of crash course on different subjects that you can watch just in case you forgot the material or you just need a refresher. That was amazing. And then they have the questions. So definitely I would do the videos for the crash course and the questions. And it's at affordable price. So I would definitely check that out. I'm going to put the link below so you can check out Archer and check out their questions. Even if they got free samples, just check those out. But it's more affordable. UWorld is pretty pricey, and it doesn't come with crash courses, you know, um, crash course lectures. They're more like lecture. There's someone speaking about the subjects, and they're really, really good. And not only I did it, I recommended to one of my classmates who also failed the first time, and she passed in 75 questions too. Like, really just did what we had to do. Archer was really, really good. And if I did not use Archer, I don't know, but those questions were amazing. So stick to that plan. Definitely, I would highly recommend checking out Archer. Really affordable and really good reviews. But it worked for me. It worked for my classmate. And I'm sure it worked for a lot of others, especially if you're passing in 75 questions. Going up to 100 and something to 75 questions minimum is amazing. So, don't get nervous when that test just shuts off. As long as you did those steps, you study, you went over those questions. Your main priority is the questions. Make sure you're taking them every day. If you do that, you will pass. Don't even think anything else. You're gonna pass. Because I was in your shoes. I really was. And it was devastating to have to fail. And your chances get lower. When you fail the first time, your chances get lower because what happens? You get discouraged. So now you go in and you kind of get discouraged, like, oh, what if I fail again? And you have all this doubt in your mind. So to think that, I did it again and I went in the second time and I blew it out the waters is amazing. So definitely check out the link below and give Archer a try. You won't regret it. And get through the rest of the semester. Don't stress yourself out until you pass all your classes and you're down to your last semester and you're, filling out for your information to get ready to take the boards. Then you think about it. But don't rush yourself, pace yourself. Remember, you got this. If I can make it through nursing school, so can you. So just stay focused, stay motivated, stay disciplined, most importantly, because motivation wears off. Stay disciplined and tell yourself, you got this. You are going to pass nursing school and you are going to pass that NCLEX. And you're going to do it the first time. You're not going to be like me where I'm like playing around with questions. You are going to get Archer from the very beginning when you start studying. If you prefer UWorld, that's up to you. But I would say get Archer. That way it's something simple. Do the questions, like I said, 100 to 150 every day for at least 30 days. If you want to take it in 2 weeks, then you're going to have to like triple those amount of questions to make sure it equals the same amount. That's totally up to you, but I would suggest at least 30 days. Take as much questions as you can, and then by that time, you will be ready to go. Don't doubt yourself. You got this. If you have any other questions, just definitely reach out to me. If anybody's interested in psych, I will be putting up more videos because I am in psych NP school for my psych nurse practitioner degree. I do want to put up some videos about that. If any of you are, done with nursing and are going straight to psych NP, I took a couple semesters. So I did health assessment, I did nursing research. I'm doing advanced pharmacology. I'll be doing advanced psychopharm. To me, in my opinion, the toughest class so far was the first class I took, which was health assessment, because it had a lab and they're all online. So me and my friend slash coworker, we are taking the same courses in the same exact school, and we were basically recording ourselves for our health assessment labs. And then we had a final where we had to do every system all together and remember everything off that paper. When I tell you that was so stressful, it was very stressful. I'm actually going to put one of the videos up here for you to see what we were doing. And everything was 5 minutes. It wasn't horrible. It was like 5 minutes. And actually, this may be good for you because in undergrad, you do the health assessment too. You do that as well. I know I did that, and it was kind of during COVID, so we had to like record, but it wasn't as intense as the graduate program. But you may want to see this video too, so I'm gonna put this video up right here. Hi, my name is Tadeja. I'm a nursing student. Today I'll be doing a physical examination. All right, posterior thorax is elliptical. Hi, my name is Tadeja. I'm a nursing student. Today I'll be doing a physical examination. Okay, posterior thorax is elliptical. No skin rashes, no lesions. Skin is intact. AP diameter is 2 to 1. Okay. Let me know if you have any pain every time I touch you.
No. No. No.
Okay, now I'm going to test for tactile affirmatives. Say 99.
99. 99. 99.
Tactile affirmatives is negative. Now I'm going to have you inhale, in and out. Okay. Respiratory expansion is symmetrical. All right, now I am going to percuss in all 14 areas. Okay, percussion is resonant. All right, now I'm going to auscultate. All right, take a deep breath. Okay. All right, and in all 14 areas, lung sound is vesicular. Okay, now I'm going to have you say 99.
99.
Every time I touch you.
99.
Okay.
99. 99. 99. 99.
Okay, and I do that in all 14 areas.
99.
Okay, bronchophony is negative. 99 is muffled and indistinct. Okay, I'm gonna have you say E.
E.
Every time I touch
E.
you.
E. E.
Okay.
E.
And I test in all 14 areas.
E. E.
Okay. Egophony is negative, no E to A change. Okay, now every time I touch you, I'm gonna have you whisper 1, 2, 3. Okay, and I do that in all 14 areas. Whispered pectoriloquy is negative, 1, 2, 3 is inaudible. Now I'm gonna have you lay down for me. All right. Aortic region is the second, right side, second intercostal space. S2 is greater than S1. Then I'm gonna go to the pulmonic region. That is the right second intercostal space. S2 is greater than S1. All right, Erb's point, that's the third intercostal space on the right side. S2 is equal to S1. Then I'm gonna go to tricuspid region, which is the right side, fourth intercostal space. S1 is greater than S2. And then I'm gonna go to the mitral region, which is right side, fifth intercostal space, midclavicular line. S1 is greater than S2. All right. Then I'm gonna take my stethoscope up and I'm gonna palpate the PMI. Okay, PMI is discrete and barely tapping. Okay, I'm gonna have you go over to your left side for me. Okay, then I'm gonna listen again in the mitral region. Okay, no mitral murmurs heard. All right, I'll have you sit up for me, lean forward, hold your breath. Okay, I'm gonna go on the aortic region, second intercostal space, right sternal border. No aortic murmurs heard. No splitting of S1 or.
Hi, my name is Amanda and I will be doing a physical assessment. We'll start with the abdomen. First, we are going to inspect for any lesions, masses, moles. All are not present. Oh, that sounded retarded. Okay, hi. My name is Amanda and I will be doing the physical assessment. First, for abdomen. Hi, my name is Amanda.
The time is just moles or no pulsatile masses. Okay, now I am going to auscultate in all 4 quadrants, starting with the right lower quadrant, going in a clockwise manner. Okay, Bowel signs is present in all 4 quadrants. Now I am going to palpate. Start with a light palpation. Tell me if any pain.
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Okay, now I'm gonna do a deep palpation. Any pain?
No.
Any pain?
No.
Any pain?
No.
Okay, any pain?
No.
Okay, now I'm going to percuss in all 4 quadrants. Okay, percussion noted is tympanic. Okay, now I'm going to do the Murphy sign. Okay, standing up here, I am going to go on the right upper quadrant. I'm gonna have you take a deep breath. Any pain?
No.
Okay, there. So Murphy's sign is negative. Now I am going to do McBurney's point. Okay, I'm gonna touch in the right lower quadrant in between the umbilicus and the iliac crest. I'm gonna palpate. Any pain?
No.
Okay, no pain. Okay, now I'm gonna do the Robsy. Hope this helps. Again, check out the link below for Archer. For all of you who are interested in making extra money, I do digital marketing as well as travel entrepreneur. If you are interested in any side gigs, please check out my other videos. I will talk to you soon.